Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Thiopentone does not cause. Thiopentone will cause. Actually, thiopentone causes. It is rapid action. It has poor muscle relaxation and it is restless. But it does not cause analgesia. Thiopentone sodium is actually an anti-analgesic. The action is rapid, that is within 15 seconds of brain arm circulation is seen. So it is rapid action. It is not a muscle relaxant. Initial restlessness is seen sometimes with thiopentone sodium, though very rarely.
thank you and thank you for watching.